Hey girl, hey, it's your birth bestie, Nurse Rini, and I am back with a conversation piece for you and something for you to consider. Make sure you like, comment, share, and follow for more. Please follow. Let's build a community. Let's talk about the things because there's a lot going on these days, and a lot of it could potentially impact you guys, my pregnant women and mothers to be, and new mothers, experienced mothers, and women in general. So I saw this post on Reddit, and I know it's not an actual Reddit post, it's probably like from Facebook or something, but this is what it says. I have a complex question. My daughter, who is 6, is unvaccinated and got chickenpox from her friends last year. Since then, she started kindergarten and failed last month's hearing exam. We went to the audiologist, and she does, in fact, have 40 to 50% hearing loss in her left ear. It's permanent loss and sudden, no history or trauma. We were then told to see an ENT, which is an ear, nose, and throat specialist, who we saw this past Wednesday. He said we'll retest in 6 months to see if it's progressing before doing an MRI or scans to try and find an underlying reason. But his first question was if she had had measles or mumps. I told him no, but she did get chickenpox. He asked if she had any near her neck, and I couldn't remember. He then said that chickenpox, if it has the shingle strain, may cause hearing loss. He is 95% certain that's the reason for her hearing loss. Now I really feel conflicted. I didn't vaccinate for fear of vaccine injury, and my child is injured because I didn't vaccinate. Since she now most likely has the shingle strain, she may most likely get shingles later in life and risk further to her ears being damaged. Her dad is still anti vaccines, but I'm looking to see if anyone has any insight. Now, originally, I was going to come to you guys with this because I think this is really sad. And I think what's sad about it is preventable. And I know there's a lot of hesitancy with not only vaccines, but with, trusting healthcare. I trust people to know what's going on with their bodies, not necessarily to know the ins and outs, but to know whether or not they feel that something is wrong or off. After all, that is what drives us to the doctor or to the hospital, right? But at some point, we have to remember that there is a profession behind a lot of healthcare. There are people who have dedicated their lives to research, trials, testing, and information gathering. People who went to school for this. Should you question some medicines? Absolutely. Ask away, ask all of the questions. But guess what? I'm not an attorney. And if I were in trouble and needed defense, I wouldn't think that I know better than my attorney. Might I question their strategy? Sure. May I ask questions to better understand what's happening? Sure. Will I take their advice? That's up to me, but it would be only after I did the research and got reputable sources. So I saw that post yesterday and was going to post on it and didn't. And now, unfortunately, today this article came out. It says measles death of unvaccinated child in Texas outbreak is first fatality in U.S. in a decade. There's a subheading that says the majority of cases have occurred among unvaccinated people. The article reads an unvaccinated school aged child in Texas has died of measles, the first death associated with an outbreak in the western part of the state that has infected more than 100 people. Lubbock City spokesperson Lauren Adams confirmed the death to ABC News on Wednesday. In a press release, the Texas Department of State Health Services said the child was hospitalized in the northwestern city of Lubbock last week and tested positive for measles. As of Wednesday, 124 cases of measles have been confirmed associated with the outbreak, according to data from DSHS. Almost all of these cases are in unvaccinated individuals or individuals whose vaccination status is unknown, and 18 people have been hospitalized so far. Children and teenagers between ages 5 and 17 make up the majority of cases, with 62, followed by 39 cases amongst children ages 4 and under. The outbreak began in Gaines County, which has become the epicenter, with 80 cases confirmed among residents, according to DSHS. The outbreak has since spread to several countries in the region and is suspected to have spread into New Mexico, according to the New Mexico Department of Health. 9 cases have been confirmed in Lee County, which borders Texas. Of the 9 cases, 4 are among children. This death underscores the real danger of measles. It's a severe disease that can take lives despite being preventable with vaccination. Every new case is a reminder of why vaccination is critical. Tragically, with an outbreak of this scale, a fatal case was not unexpected, especially among those unvaccinated. Given how contagious measles is, we anticipate more cases in the coming weeks. Dr. Laura Johnson, a pediatrician for nearly 2 decades and the chief medical officer at Covenant Children's and Covenant Health, says she never expected to be working in the midst of a measles outbreak. Right, because this is so long ago that this was an issue. I've personally never had measles. This is the first time I've had any professional experience with a measles outbreak, Johnson told ABC News. I saw one travel related case when I was in medical school, very briefly, but at that time, back in around 2000, we really thought that we'd eradicated measles from the US and didn't have any anticipation of seeing any outbreaks here. Johnson says her health system has had about 20 unvaccinated patients hospitalized in this outbreak over the last several weeks. Most have been kids admitted due to difficulty breathing associated with pneumonia, but so far they have not had cases of encephalitis or inflammation of the brain. So, pneumonia in it of itself is very serious, regardless of the source. So, this is something, again, that is preventable. Encephalitis, obviously, inflammation of the brain, is also extremely serious and can render other bad outcomes. Dr. Ari Brown, a pediatrician in Austin and spokesperson for the American Academy of Pediatrics, told ABC News, "We've been getting numerous calls at our office about whether their kids and babies can get a measles shot early. I've seen measles and it's horrible," Brown said. "Those kids are super sick, and once you've seen it, you can't unsee it." During Wednesday's cabinet meeting, Health and Human Services Secretary Robert F. Kennedy Jr. responded to a question about the outbreak, saying the agency was following cases in Texas. Kennedy appeared to downplay the outbreak, noting there have been 4 outbreaks so far this year compared to 16 last year. However, the number of cases in Texas alone amounts to nearly half of the 285 cases confirmed in 2024. So Kennedy is downplaying it because if he acts like it doesn't exist, then people won't blame him, and he can't carry on with his anti-vax campaign. He goes on to say it's not unusual. We have measles outbreaks every year. Kennedy also claimed the reason the children were hospitalized was for quarantine purposes. Not true. Johnson said during a press conference on Wednesday that children are not hospitalized for quarantine. Hospitals don't have the capacity to have you laid up for no other reason other than to keep you isolated. They don't. Measles is one of the most contagious diseases known to humans. Just one infected patient can spread measles up to 9 out of 10 susceptible close contacts, according to the CDC. Health officials have been urging anyone who isn't vaccinated to receive the MMR or the measles, mumps, rubella vaccine. Right, because we're talking about measles, but there are 2 other viruses that you can contract if you don't get this vaccine. The CDC currently recommends people receive 2 vaccine doses, the first dose at ages 12 to 15 months, and the second between 4 and 6 years old. One dose is 93% effective, and 2 doses are 97% effective. Most vaccinated adults don't need a booster. Measles was declared eliminated from the U.S. in 2000 due to the highly effective vaccination program. However, vaccination rates have been lagging in recent years. About 93% of kindergartners nationwide received select routine childhood vaccines, including the MMR for the 2022-23 school year. The bottom line is, guys, this was preventable, and we're going to talk more about vaccines in my part 2. Like, comment, share, and follow for more.